Today's presentation is by Heidi Zetzer, and I'm delighted to have her with us. Heidi is the director of the Hosford Training Clinic at the University of California, Santa Barbara. Also is president of the Association of Psychology Training Clinic. Is on the faculty of the Clinical and Counseling Psychology program at UC Santa Barbara, and immediate past president of the section of Supervision and Training of Society for Counseling Psychology. So I should add that Heidi has done research on parallel process, which is our topic for this. So Heidi, would you explain what it is in a way that we can all get a handle on it?
Concept originates in psychodynamic theory. So the relational aspect of supervision is very prominently played out in parallel process. So parallel process occurs when the therapist unconsciously enacts the patient's dynamic in supervision with the supervisor. And that gives the supervisor insight into what might be happening in the therapeutic relationship.
Okay. Do you have an example of that would be really clear to our listeners?
Yeah, two classic examples are helplessness expressed by the client, which then the therapist identifies with in some way, and the therapist then expresses that helplessness in supervision with the supervisor. Another example is the yes but client, who becomes frustrating to the therapist perhaps in therapy, but then the therapist begins to display that yes but verbal behavior with now the most important thing here is the supervisor perhaps has some awareness or understanding of this concept, and also is kind of far enough away from the action to perhaps think about what's really going on. So the concept of parallel process becomes a hypothesis about what's really going on.
Okay.
Yeah.
Let's go with the yes but example. I think that's one that many of us can resonate to as supervisors. Some supervisees who are just characteristically into yes but. So I assume that something different happening in the session that got your attention.
When parallel process occurs, it's an aberration, it's an unusual event. The therapist or the supervisee starts behaving unusually in session, so it's not an expression of their personality. It's more that they're bringing the interpersonal process in psychotherapy into supervision. They have no awareness of that. And many times the way the supervisor identifies the possibility of parallel process or an isomorphism is through self-reflection or self-awareness. So I start to feel frustrated or tense, impatient, is a signal that perhaps I should pay attention to the dynamics that may be transmitted up the line into supervision.
Okay, that's helpful. And I know in our other conversations we've had, you've mentioned that multicultural issues sometimes play themselves out in parallel process. Would you say something about that?
An example of this is cultural mistrust. Clients from more marginalized, oppressed communities may enter our systems with a fair amount of cultural mistrust. So in an example, let's say we have a Native American client working with an African American therapist, supervisee, and then a Latinx supervisor. Let's assume that things have been going well, but now the therapist has a new client who brings this cultural mistrust, and then the supervisor begins to see some mistrust in their relationship. And what's critical here is the supervisor's attunement to that, noticing that this is a change or a shift from what's been happening before. And the supervisor wonders about that, and then does something differently in supervision, is perhaps gives the therapist supervisee an experience and to have the feeling of increased trust. And then that increases the likelihood that the therapist is going to be able to bring those interventions into therapy with the client.
You're alluding now to what you might be doing as a supervisor. Would you talk a little about that? Because I assume it's not just a matter of saying, aha, I think we have a parallel process going on here.
Correct. In the research that I did with 7 colleagues across the country, we interviewed 9 supervisors and asked them how they identified parallel process and what they did in response and what the impact was. Mostly they do things that are quite reparative. So the supervisors would do things like engage in immediacy with the supervisee in supervision and talk about their relationship. In the cultural mistrust example, it would be perhaps revisiting social locations, thinking about what does that mean in terms of how we engage with one another. Of immediacy, some appropriate self-disclosure on the part of the supervisor to repair any rupture or potential rupture. So they're very relational kinds of intervention. It could also be more of a teaching intervention. The supervisor might wonder out loud with the therapist supervisee, I wonder if this, how are you feeling with me? Okay, perhaps we sense this distance, but I wonder if the client is perhaps feeling some sense of mistrust.
Mm-hmm.
How can we work in here? How can I help you help the client feel more trusting in what we have to offer? Right? So it could be an implicit process that the supervisor offers or an explicit one. Teaching and instruction or actually providing an experience in supervision that the therapist then gets to use in psychotherapy.
To return to the yes, but example, how might you intervene there?
These are the most frustrating situations. That's why that self-awareness and self-reflection is so critical. And in some ways, opportunities for the supervisor to have the experience that the therapist is having is very useful because it creates some empathy for the therapist, right? So we really want to enhance empathy all around. At least for me, there's a tendency to push harder or press harder, but that is only going to exacerbate the problem, right? Exacerbate the issue. So being able to take a step back as a supervisor and reflect, consult with other supervisors, other people who are involved in this group is a great idea, because a more indirect approach is useful when someone is engaged in this kind of yes but dynamic, right? So some exploration of what their fears or anxieties are, they're kind of caught or trapped. And just as the client feels caught or trapped or stuck, the therapist feels caught or trapped or stuck, the supervisor is going to also feel that way. So something new and different is needed. And the supervisor is the most likely to be able to help wiggle out of this trap that they're in. 3 easy steps. And this is a critical events model. So this is how it works. The model starts with the critical event. And so there's a marker for that event. In the case of parallel process, it's the supervisor noticing their own reactions. And either that are directly related to the therapist's behavior, or perhaps they're just reflecting on their own behavior and maybe being dissatisfied with what's happening. And so there's a marker. Or it could be that the therapist just is behaving differently in supervision, and so that's a marker. So marker is the first step. That's followed by the task environment, and that's the pragmatic term for everything that the supervisor does in response. And so the supervisor makes a shift in supervision, and that's a really systemic way to view things, actually. So the family systems people will like that a lot, that you're not doing more of the same. You are doing something differently, which will disrupt the pattern and hopefully free people up to behave differently. And then that leads to some kind of resolution. The resolution that we're likely to see, if things go well, is some repair in the supervisory relationship or some improvement in that functioning, and then also in the therapeutic relationship.
Heidi, I know that you've compiled a case example to illustrate some of the things you've been talking about. So maybe you could walk us through that.
The client is a 30-something Asian female who appears to the supervisor to be in an abusive relationship with her partner. But the client does not acknowledge it for cultural reasons, including that she doesn't want to disrespect her spouse or his parents with whom they live. She feels stuck in the marriage, and she also feels stuck in therapy, and she tells the therapist that she feels stuck in therapy and in her marriage. So she's asking for help. The therapist is late 20s Latinx male who's reluctant to judge the spouse or what's happening in the relationship or to see it as abusive, because he doesn't want to take a judgmental stance. He's concerned that his views are culturally laden and he's trying to be sensitive. He disagrees with the supervisor's assessments for this case and the suggested interventions. And he also feels that his multicultural training makes him more knowledgeable than the supervisor. But he also feels immobilized, so he's asking for help too. So now the supervisor, we're going to assume this supervisor is fabulous, but also as a supervisor feels somewhat immobilized by all of these dynamics. So what markers do you see? What might you do in response? And what kind of outcomes might you expect based on the way that things So in my view, the chief marker is that everybody feels stuck. the client feels stuck, the therapist feels stuck, and the supervisor feels stuck because there are these conflicting forces. There's desire to avoid imposing one's culture on other people from whatever location, but then there also is a desire for things to change because it is a harmful and hurtful situation. So everybody feels stuck in this dialectic. And so the task then for the supervisor is to free everybody up, if possible. I changed some of the identifying features of it, but this is a real scenario. So the therapist in supervision explored his ambivalence with the supervisor, was able to take that experience and help the client explore her ambivalence or her fears or her wishes about how it would turn out. And she did vocalize her feelings of hurt and pain, and that family actually responded positively, the spouse and the parents, and everybody worked hard to get along better. Was so grateful at the end that she wrote this beautiful thank you note to the therapist, who felt very efficacious and useful.
What a nice example. Thank you.
Yeah, it really was. I have a warm feeling as I think about this case.
Heidi, you talked about this having psychodynamic origins, and yet my impression is that most supervisors could make use of this. The family systems folks talk about isomorphism. And so would you talk about that? And then I'm imagining some of our CBT colleagues watching this wondering what the heck has got to do with me? So it's kind of a two-parter. One, would you talk about isomorphism, and then how it might apply to folks who wouldn't ordinarily think in these ways?
From a systemic standpoint, and not only family systems, but even more broadly, sort of multiple systems, because we have families who are in treatment and agencies that have their own system, and then there's the broader sociopolitical. So the idea with isomorphism is that interpersonal patterns of behavior get replicated across these layers. That happens for various reasons. Some of it might be help seeking. So the client seeking help, the therapist is seeking help from the supervisor. The supervisor may be seeking help from their supervisor. So you get this kind of dynamic of powerful and powerlessness, and that's interpersonally expressed. So we're not making any interpretations about intrapsychic dynamics or even emotions or thoughts. We're just looking at patterns of behavior. The great thing about the systemic view is that it's inclusive of not only these dyadic relationships, but you could look at a group supervision as part of the dynamic. You could also look at the agency and even the community and the country, because all of these patterns may manifest themselves up and down this chain. So sometimes changes the supervisor make are going to be second order changes. So they give the therapist an experience the therapist can use in therapy that helps the family. Second order change. But it might also be that the supervisor, perhaps with the therapist, engages in some kind of advocacy or organizational change that ends up helping the family. So it could be providing childcare or increasing access, paying for parking, getting bus tokens, right? So it's something that has to do with the broader system that's impeding the family. So that's third order change, right? Because it's the larger circle. So I hope that's helpful. But the idea is you see patterns like up and down, like ripples, right?
Great. That's helpful. And I'm sure our systemically oriented folks can resonate to that. So now to what may be the group that's toughest to sell this to, which would be our CBT colleagues.
Actually, no. As I think about cognitive behavioral therapy, the beauty of that supervision approach is that what the supervisor is doing with the therapist is very similar to what the therapist is going to do with the client. So let's take this concept of helplessness. The client has thoughts of helplessness, and then the therapist also has thoughts of helplessness. And in supervision, the supervisor, if they're using a CBT case conceptualization, would also be addressing some of the therapist's thoughts about the work that they're doing. So in some way, it lends itself even more elegantly to interventions in supervision that can be applied in psychotherapy. The parallel process part is that there's similarities, again, some sort of thoughts about helplessness that are starting in one place and getting replicated in another, starting with the supervisor. And then that is getting pushed on down through the therapist to the client.
You've given us a really good overview of what parallel processes and isomorphism are, and how to recognize them and how to intervene. And and made a really good case for supervisors paying attention to this. Yes, I've got a couple of follow-ups. One is, how often does this occur? So I assume this isn't like every session. And then what are some caveats?
Really good point. So I have a passion for parallel process. So when you listen to me, it sounds like this happens all the time and we should be all on the lookout for it. That is not the case. Definitely a very low frequency event because it doesn't happen that often. There's been some studies with AAMFT supervisors who also reported that this is a low frequency event, but it has high value. So it's one of many hypotheses that supervisors might hold in their mind, struggle with challenges that come up in supervision. The danger is actually in overusing this idea, especially if you're exhausted and frustrated yourself as a supervisor. It might be easy to blame the therapist for getting caught up in the client's dynamic. Avoid defensive use, like this is something the therapist is doing and I have nothing to do with it as the supervisor. Whenever I feel my authoritative self getting activated, I take a step back and I think, what's going on here? And that's what I would suggest to everyone. So the concept of parallel process was first called reflection process by Searles in 1955. Then Eckstein and Wallerstein called it parallel process in 1972. And since then, everyone who is a theorist or a researcher or a practitioner who sees value in this concept says that it can go either direction. Bottom up, so from the client all the way up to the supervisor, or from the supervisor on down to the client. And that's harder to detect, right? Because the person with the best ability to detect this is the person who's initiated the phenomena. And so at least for myself, when that has happened, it's taken a while to figure out. And it's usually for me when things aren't going well and I can't quite figure it out. I have to mentally chew on it for a while. Then the possibility of parallel process that has started with me as the supervisor comes worth consideration. Yeah.
Would you give an example of a top down?
How about a case?
That'd be perfect.
So this is a case, again, that I wrote up drawing from lots of different kinds of scenarios. The client is a 40-something Latina, so woman. Client has very high levels of anxiety and depression and a history of childhood trauma and stormy relationship. Also a diagnosis of PTSD and major depressive disorder. Has chronic acute suicidal ideation, so pretty much lives with suicidal ideation. And this is a routine part of therapy. Routine in that it's repeated, not that it's not important. So the client insists that the only reason that she hasn't heard it she worries what will happen with her cat, and she'll stay alive for her cat. She's pretty explicit about that. But her cat is old and sickly, so everyone's worried what she'll do if the cat dies. In this case, the therapist is a 30-something Anglo-American male. The therapist and the client have a good relationship, and the therapist actually has pretty good skills, so is managing this kind of chronic ideation fairly well. The supervisor is a professional with many years of experience. The supervisor becomes worried about the client's chronic suicidal ideation because it's increasing in intensity because the cat is not doing well. The cat's actually quite ill. And the supervisor urges the therapist to convince the client to go see the agency psychiatrist. The intention is medication might help prevent any kind of disaster that would occur as a result of the cat dying. So the therapist says to the supervisor that the client won't like it, but the therapist is persuaded by the supervisor who's activated about this that it has to happen. So then the therapist goes to the client and convinces the client to go see the psychiatrist. The appointment does not go well, so the client then returns to therapy and is sullen and withdrawn. The therapist then goes to the next supervision session and is also sullen and withdrawn. So the question for our supervisors here is, what are the markers? What might the supervisor do? And what kind of outcomes might you expect to see?
Thanks, Heidi. This has been really helpful, and I know I've learned some new things. And also, I know you'd prepared a closing slide, so maybe this is a chance to express appreciations to you and ask you to end with your slide.
So this slide is my wish for all of the supervisors who are listening and engaging in this training, that there are moments that you have where you can sit on the end of a little pier in a beautiful setting and reflect on life's patterns. Reflecting on those patterns can be helpful to us as supervisors in order to find the keys to doing things differently that might be helpful to our supervisees and to their clients, and also help us appreciate the patterns of goodness that we have in our lives and how we can notice those and perhaps enjoy them when we get the opportunity to do that. So thank you all very much for joining me in this exploration of parallel process and isomorphism. I hope that you found some value in today's class.
Thank you, Heidi.